I think we should all realize that as we get older and older, I'm in the process of it. Um, when I when I was young, I can run faster, I can stay overnight without any rest. And then when you get older, you feel tired more easily. Your eyesight is not as good, your hearing is not so good. So that's the beginning of your aging process. Okay? And then when you get sickness, you will start to lose other abilities that you used to have. Some ability to bath yourself, wash yourself. Sometimes you lost ability to go to toilet by yourself, how to feed yourself. I mean, all these are very essential part of your life, but you cannot do it by yourself and you need other people's help. Death is just the final stop, but the process is a process of losing control. And it's a process of asking people to getting more and more into your life to help you with what you cannot do by yourself. I mean, with the technology these days, it is really hard to die if your doctor do everything, try to prolong your. If the heart is not beating, we can make it beat. If the lung is not breathing, we can pump air into your lung. If you cannot eat, we can make a little hole and feed whatever nutrients we want to put in. If the urine doesn't come out, we can put a tube inside and let it out. I mean, there are so many things that we can do to just continue so-called life. But does that really doing a service to the patient, or are we just prolonging suffering? I think that is something that we should think about and balance in each and every patient. When I was a student in primary school and in high school, I've always been interested in biology. But what really struck me was at the age of 14, while I was doing my homework at home, I got a phone call from my grandmother saying that my grandfather has a major illness. As a matter of fact, at that time he was vomiting blood at home quite suddenly, and the bleeding seems to be uncontrollable. So he was vomiting blood in the toilet, in the bedrooms, and everywhere. So obviously my grandmother was very scared, and I was asked to go and help them. When I arrived at the scene, I saw my grandpa was very ill. Blood kept coming out from his mouth. And it was quite scary to see blood everywhere at home. And I have to call for ambulance, first time in my life, and send him to hospital. And I still remember when I sent him to hospital, he was very ill. Doctor pushed him to the operating room immediately. And then after a few hours, my family came. Doctors come out from the operating room telling us that he has a cancer in his stomach and it is inoperable. That means nothing can be done. So it was basically what we call an open and closed surgery. And then I have to live with them to take care of my grandparents for the next few months. So that was the first time that I encountered death and watched the whole process of dying of my grandfather. I think that experience gave me several messages. One is that I really like to, in my future studies and my future career, I would like to learn how to take care of people who are very ill, to save somebody's life. And also, I feel that from the patient and the family's perspective, a doctor can be more than just operating on the cancer or prescribing drugs. There's a lot of things that they can do to make the family feel easier in such difficult time. As a patient or as a family member of the patient, obviously you feel quite helpless. You feel a lot of uncertainty. It's basically you don't know what to do, you don't know what you're going to face, and you have to ask doctors every step of the way. Helplessness, I think it's the word to describe most of this situation. A very famous physician about 100 years ago, his name is William Osler. One of his very famous quotes is that a good doctor treats the disease of a patient, but a superb doctor treats the patient who has a disease. So I think holistic medicine means that we're not just treating, the stomach, the heart, which has a problem, or the lung, but we treat the patient as a person. What does that mean is that other than the heart problem, in fact, that brings the patients a lot of other issues, such as emotion, such as family problem, he cannot finish his job, and so on and so forth. Of course, we cannot solve all the problems of our patient, but at least we understand the different aspects of their life and the effects of the disease itself, or sometimes the treatment that we give them. If you just have a few moments to chat with the patient or the family, listen to what they really worries about, sometimes you'll be surprised that they will disclose to you something very deep in their heart, some stories that even their family might not have heard about. We may not be able to solve all the problems, but just be a good listener and sometimes offer some advice will make the patient feel much more comfortable. Even though the disease may not be entirely removed or cured, they will feel respected. They will feel that they are being well taken care of. They will feel that their dignity has not been diminished. I think those are important things to do as a good doctor. Some doctors are very good on the technical aspect, on the professional side. That means they do the right test, they do the right treatment, and tell the patient what to expect, and so on and so forth. So all the technical part is important. The skills of practicing medicine and also performing surgery is very important. But that is not all, and that alone is not sufficient, because that is still missing the human part of medicine. When I was a young doctor, I could only focus on the technical side. So to me, the patient is a cancer patient. This is a patient with diabetes. This is the patient had a stroke. That I want to solve the problem and send them out of the hospital, and my job is done. I do not remember their name. I don't care much about the family and their feelings. I feel that, well, if I get rid of his symptom and take care of his health, then I have done my job. But more and more, when I'm in the practice, I realize that care and cure are two different things. You can cure somebody's disease, you can cure somebody's cancer or pain, but it doesn't mean that you have provide them with the kind of care that they look for. Usually when we talk about palliative care, we're talking about taking care of a patient's condition that we know we're not going to solve the problem entirely. A cancer which is so advanced that we will not be able to cure it. A end-stage kidney disease that can only be sustained for a certain number of years, but the patient is gradually going downhill and you have to You have to expect that and you have to manage that. So, in such circumstances, palliative care is more than just prescribing drugs and treating the disease itself, but to help the patient to go through this last part of his journey. And of course, relieving symptoms is part of it, but also to prepare the patient how to face death, how to face uncertainty in his life, and also just to guide them and to be with them in the last part of his life journey. We also know that in alternative medicine or in traditional Chinese medicine, it is actually looking after this aspect quite well. Because, for example, in Chinese medicine, doctors will be seeing patients quite frequently and adjust the medicine, feel the pulse, and look at the face and talk to them, and then adjust the medicine almost on a daily basis. Okay? And I feel that they're not just prescribing drugs, but they also listen to the patients and observe what is the change of their conditions from day to day. And in Chinese medicine in particular, they emphasize a lot on balances. Okay, a balance of the yin and yang, a balance of heat and cold, and dryness and wet, and so on. I do not pretend to know everything in the Chinese medicine theory, but they emphasize on the overall well-being of a patient and to balance the various physiological function and the psychological function of the patient. I think that is quite important. In general, young people really have a bigger drive to go through every treatment that is required so that their life can be saved. For elderly people, sometimes we have to think about what is the meaning of prolonging their life? Are we prolonging suffering or are we prolonging meaningful life? And this has to be really discussed with the patient in great detail. There are many examples, but one of the most famous one is recently there is a book called Being Mortal, written by a surgeon in Harvard Medical School. He himself is a doctor, and his father was also a doctor who unfortunately developed Parkinson's disease. As a doctor, he would try everything to make him better. But finally, he realized that it is really not what his father wants. And it should not be just prolonging his suffering and giving him some meaningless time. I think that book triggered me to think about just being able to prolong life should not be the aim or should not be the only aim of medical practice. During this COVID pandemic, as well as during the previous one, the SARS pandemic, we are facing, number one, a lot of uncertainty because these are diseases that we have never seen before. And one of the most serious one is, in fact, because this is an infectious disease, you have to isolate people from their families. Therefore, patients, no matter how ill they are, sometimes they have to be put on a single room. Nobody can go in. And the heartbreaking moment is really that we see somebody who is dying, but yet the family cannot go in, hold their hands, talk to them, and see them for the last time. I have seen doctors who became patients in the SARS pandemic, that they become critically ill. This is a young lady doctor at the age of 30. She was already so ill that she has a machine to help her breathing. She has machine to help her heart beating and so on. Yet the family cannot go into the ICU to meet with her. I saw parents just touching on the monitor outside the ICU because they cannot touch her hands or her face. That is a heartbreaking moment. And so this sort of isolation is a great challenge to both the patient as well as to the healthcare workers. That is something that in a medical school we should emphasize on. We are not just training skillful surgeons and technicians, but doctors with a heart and flesh. Well, I think first of all, patients have the right to know everything about their own health. We'll try not to hide anything from them because they have to know so that they can make decisions and judgment on what should we do next. Secondly, we have to respect patients' privacy. So whether or not they want to disclose this to their friends, to the family, to the boss, to the employers, I think we have to respect their wish and their privacy because this is really something that they should be given the right to choose. While disclosing the bad news to the patient, we can do it step by step. We can do it at several stages so that they will gradually realize how severe, how serious the problem is. I think sometimes this may make it easier for them to accept and to prepare for their future. There's really no hard and fast rule how it should be done. It depends on how the patient responds, and also depends on the maturity of the doctor, how he or she has been able to communicate with the patient based on their experience. I remember there was a patient of mine back in Hong Kong. She is a very successful businesswoman in the age of 50s. She's single, but she has a lot of siblings, brothers and sisters. But she herself is living alone. She came to me for some vague stomach discomfort, and I have to do a lot of tests and follow actually for a few months before we found out that she actually got a very rare cancer in her pancreas. She was still quite well at that time, but I told her that this is going to be a very difficult disease and we may not be able to cure the cancer for her. The first reaction she got is, don't tell my family. And in fact, I don't have my own family, but don't tell anybody among my siblings. I just want to gradually disappear from Earth. So I find this quite weird. And I feel that for a patient at her age and at her situation like that, she would need people to help her instead of just disappear. On one hand, I respect her wish. She doesn't want to bother people around her. On the other hand, I would try my best to convince her that she should not just face this by herself, but people can help. All in all, I feel that in the last few months of her life, I have earned her trust and her respect because I make her feel that her wishes are being respected and her dignity is preserved. I keep use the word dignity because in terminal illness, a lot of time, you have to do this surgery and that treatment, put the tubes in the patient's nose, put a tube in the patient's bladder. I mean, a lot of things being done from a medical point of view, from a physiological point of view. You are trying to help the patient. But from the patient's perspective, they feel that they are losing control of the bladder function, of whether or not they want to eat, whether they should sleep or wake up. Everything is being controlled, and everything is being monitored by the machines around them. So in my mind, managing a patient in a terminal illness, we have to be sensitive about patients' feeling. Sometimes you thought you do something really good, but the patient may not actually feel the same. They feel that they are becoming more miserable because of all this treatment that we imposed on them. Well, usually young doctors are more focused on the illness itself and how to get the test done properly, how to do the surgery well, and so on and so forth. But when he's getting more and more experience, he will realize that this is only part of it. I think in medical school, both in my time as well as now, students are sort of trained to solve problems. Sometimes we even call this problem-based learning. So the problem is he has diabetes and the blood sugar too high and leads to eye problems, leads to kidney problems. So you have to solve these problems. But sometimes what we have not emphasized enough is the person behind these problems. How does he feel, and how he sees himself, and so on and so forth. Patients may actually not comply to your treatment if they feel that they are a burden to their families, if they actually don't care about themselves, if they hate themselves because of all these problems. It's not easy to be trained in classrooms or in lectures. I think the best way to train them is by showing them example, by exemplifying how a doctor should be in the clinic, in the hospital, or even home visits and so on. How you talk to the patient, you listen to the patient and the family, and how to explain things in a sensitive way to take care of the feeling of the recipient. I mean, all this do not have hard and fast rules. It's a life experience. The reason why I'm keen to go back to clinical practice, other than just teaching in a classroom or doing my research or administration as a dean of medicine, I would like to see and try to exemplify how we should talk to the patient in the clinics, in the real life setting. And also to observe whether our students who now become doctors are actually doing the right thing. Whether we taught them right to be not just a knowledgeable doctor. I mean, in this day and age, computer can do a lot of technical things. But what a computer, what a robot cannot do is the human touch of medicine. And that's something that makes us irreplaceable. To reflect upon our professional job, it's more than just knowledge and skills, but there is a lot of human touch that we can put into it to make people feel better. And that is something that in a medical school we should emphasize on, so that we are not just training skillful surgeons and technicians, but doctors with a heart and flesh.